In the meantime, other news we're following in Washington concerns progress of the health care vote, if and when it comes this week at all. Phil Gramm, the former Texas senator, telling me it's important that they get a vote, yay or nay.
30 Republicans are uncommitted. Reagan calls them down to the White House. We're all sitting around the cabinet table. And by the time we got around the table back to me, almost everybody was with Reagan. It was just their constituents. So Reagan sat there and he didn't say a word for it seemed like 5 minutes. And then he looked at everybody and he said, you know, I was confused. I thought this was about country. I didn't know it was about constituency. And he got up and left. He got up and left. That was the end of the meeting.
How did the vote go?
The next night, we called a roll. We won by 1 vote.
And the tax cut revolution was on. That was then, but the president at the time saw the wisdom of going ahead and holding everyone accountable, voting yay or nay for what would be something that would structurally change the United States and lead to a jobs boom with 20-some-odd million jobs created. Of course, this fellow probably wasn't even born at the time. I'm talking about Senator John Thune, Republican of South Dakota. And Senator, it's always good to have you.
Thanks, Neil.
I joke, but to make the point here that Ronald Reagan said then, sometimes there can be a great value in going ahead and holding a vote, because you're never going to get the exact circumstances or the exact commitment that you want. But sometimes holding the vote puts pressure on people. And they're accountable. What do you make of that?
Well, I think that's by and large true, Neil. I think that when push comes to shove and you actually have to declare and make that vote, it really elevates and raises the stakes in terms of any conversation about a major issue. That being said, I would probably come from the school that I would want to make sure before I put it out there on the floor that I had the votes. And I think they're in the process of doing that. The whips are working, trying to work their magic over there, get the various competing factions in this discussion to come together so that they can get the 216 or so votes that are necessary to pass it in the House. And I hope that they'll get to that vote total, be able to put the bill on the floor, move it, and send it to us, and we'll have an opportunity to go to work on it in the Senate.
You know, I've heard from a number of Republican senators, though, who said it would be far more embarrassing us right now to shelve a vote than even to lose that vote. What do you think of that?
I think it's you can argue that both ways, and I sometimes find myself in the school that says, put it out there, let's see where people are. But like I said, I tend to sort of fall back. I helped on the whip team when I was in the House. We always like to know that we had the vote before we put it out there. I think they have to know that it's close. You know, there are always a few people that you can pick up when you actually have to say yes or no, and it maybe that's the conclusion they'll ultimately come to. But I just hope that in the end they can muster the necessary votes to pass this, because I think it's something that we need to deliver on for the American people. We need to move in the direction of a health care insurance program in this country that's sustainable, that gets these rates down for people, and creates a more patient-centered and more affordable health care for Americans, which is certainly what we don't have with Obamacare today.
If for some reason this gets delayed or voted down or significantly put off, obviously it seems like the appetite is get this done first before tax cuts are addressed. Would you be open, or do you know whether your colleagues would be open to say, all right, look, we're going nowhere fast on this health care thing. Let's proceed to the tax cut thing?
I think that in a lot of ways the tax reform debate is health care is sort of a building block to get there, and one of the reasons, as you know, is that it significantly affects by about $1 trillion the baseline, and it lessens the hill that we have to climb to get tax reform done. So I hope health care reform can move first, because we can use this year's reconciliation vehicle created by the FY 2017 budget, and I know that's pretty arcane for a lot of people, but we have to do another budget to do tax reform, and I want to get started on that.
What happens, though, Senator, I don't want to jump on you, is that whatever concessions are made to conservatives to get them in line, moderates get ticked off, especially when it looks like pre-existing conditions aren't so black and white and covered, especially when they're left in the hands of the states. Do you worry about that could be the sinker on this?
Well, I think right now that's the point of contention that they've got to resolve, and it sounds like they're trying to give states flexibility, and that may be ultimately how they fix it. But to your point, we need to do tax reform either way. I mean, tax reform is critical to our economy. We're stuck in this 1.5% growth pattern, and the CBO is projecting for the next 10 years is going to be 2%. The historic average going back to World War II is 3 to 3.5. We've got to get the growth rate back up, create better paying jobs, raise wages in this country, and tax reform helps you achieve that. We've got to simplify the code. We've got to make America competitive in the global marketplace. And so whatever happens to health care reform, and like I said, it makes more sense to do them sequentially, but if we aren't able to do that, we need to move forward on tax reform, and the sooner obviously is the better.
All right, Senator Thune, good seeing you again.
Thanks. Good to be with you, Neil.